Thank you everyone for joining us today for the National Alzheimer's and Dementia Resource Center webinar. It's more than just money, strategies for sustaining dementia programs. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. Today we have with us Shelli Fortune and Salli Bollin. Shelli Fortune holds her bachelor's and master's degrees in social work. She has worked in the field of aging for 17 years with experience at 2 area agencies on aging in Missoula, Montana and Bellingham, Washington. She is currently the in-home services director at Missoula Aging Services, overseeing the care management program, veteran-directed care program, Medicaid Community First Choice program, caring companions, and in-home support services. Also with us today is Salli Bollin, the Executive Director of Memory Lane Care Services, a community-based nonprofit organization providing respite and supportive services to families caregiving for older adults and individuals living with cognitive impairment. Salli holds a master's degree in social work and certificate in aging from the University of Michigan and a bachelor's degree in social work from the University of Toledo. She has experience delivering respite care services, implementing and evaluating evidence-based programs, serving in leadership roles in nonprofit organizations, and as an advocate for caregivers and older adults. At this time, I will turn the presentation over to Shelli Fortune to begin. Shelli?
Hello. I first want to say thank you to everyone joining us today. But before I jump into what sustainability looks like for us, I do want to say that this project was supported in part by grant number 9080PI 005901 from the U.S. Administration for Community Living. And we could not have done any of this work without the support from ACL, NADRC, and RTI. So thank you all. Next slide, please. As Sari mentioned, I'm with Missoula Aging Services, and I always like to start presentations with our mission, as it really outlines our approach to supporting our community. Missoula Aging Services, or MAS for short, promotes the independence, dignity, and health of older adults and those who care for them. Next slide. A little bit more about MAS. As an area agency on aging and a county council on aging, we might have a different look at sustainability. We're also a nonprofit with a board of directors appointed by county commissioners. These multiple designations allow us to access funding from local, state, federal, generous donors, and grant-based sources. MAS also has the dual role as an area agency on aging and a county council on aging. So meaning we not only plan, advocate, and contract for services, but we also deliver services where there's no other provider. We are located in Western Montana and serve 2 counties. Our role in the ADRD grant is as a service provider for people living alone with Alzheimer's and dementia, and those caring for people living with Alzheimer's and dementia. We also contract with a separate agency who works with people with intellectual and developmental disabilities at risk for developing cognitive decline. We have not completed our grant yet, but it has been important for us to begin exploring all options for program sustainability. Next slide, please. So sustainability is a complex issue, usually without a simple solution. To us, it was important to consider 3 main areas of sustainability: community, organizational, and financial. It's helpful for us to think of it as a 3-legged stool. If one of the legs is cracked, the stool is usable, but it's not stable. On the next 3 slides, we'll briefly discuss each area in more detail. Next slide, please. So community sustainability has 4 significant parts. First, you need to determine if there's a demand for the service. It's helpful to speak with your employees, clients, and your community to determine this. They'll have firsthand knowledge of the needs. This is especially true for clients and consumers. You never want to create a program or service for someone without asking them what their wants and needs really are. In addition to tracking client needs in our database, we are working on building capacity with our client-led advisory council And last year we completed a community-wide needs assessment survey. Second, are there other service providers meeting this need, and do they have the capacity to meet the demand in your community? If they are meeting the demand, do you think your agency can be successful in a competitive market? If they are not, what would your agency do differently or more successfully? For example, due to the lack of home care providers in our area, respite care has been very difficult to access. In response to that, we created a volunteer respite program that has seen some pretty surprising success. Next, it might be useful to partner with complementary organizations or referral sources. We have found this helpful in making programs more desirable to larger funders. It can also help increase your impact in the community by reaching larger and more diverse groups of people. For us, we have built a natural partnership with our city's crisis intervention team. This team partners with law enforcement and first responders when mental health issues arise. We receive a number of referrals from this group, and we have found a great partnership in creating a greater safety net for the most vulnerable in our community through this partnership. Finally, sufficient capacity is vital. As we all know, the pandemic has certainly brought this issue to the surface. Without enough staff or volunteers, programs are not able to deliver the services that are needed. Next slide, please. Next, we're looking at organizational sustainability, which starts with structure and capacity. This includes looking at your hiring practices, benefits, staff or volunteer development opportunities, and organizational culture. In our experience, a solid organizational structure will lead to staff retention, a reduction in burnout, and the ability to increase capacity to meet the needs in your community. Systems and processes will also play a large role in the success of a program. It is helpful to start with outlining your goals and objectives that you hope to achieve, then working backwards to create the systems that will support those results. We utilize client databases, spreadsheets, and policy manuals to ensure we're gathering useful data in a way that makes sense. Additionally, the policy manuals ensure that your processes are outlined for all staff and volunteers to follow. We found that better data collection leads to more solid results, which can be helpful when pursuing other funding opportunities. Next, it is important to determine if you're already offering services that will be complementary to your new program. For example, we have our care managers meet with all new Meals on Wheels clients for intake assessments. This has been a great way to find clients that are struggling with memory loss who may not have reached out for support on their own. And just as important as looking at complementary services, it's good to determine if you have any conflicting services. This refers to offering programs or supports that would be a deterrent for people reaching out. We have found that anything that looks like restricting independence tends to be a barrier for people reaching out for support. For example, we were contacted to help a law firm with a guardianship case. While guardianships are necessary for some clients, we did not want to begin offering a service that could be perceived as limiting someone's independence. So we decided to not go that route, especially since there's other entities in the community that can provide that support. Next slide, please. So financial stability. There's a saying that goes something like no money, no mission. So financial solutions might vary depending on what type of organization you are, but will generally include first your current resources, which are existing revenue or reserves that can be dedicated to a new program. Another option is pursuing new funding opportunities. This could include donors, private foundation, fee-for-service options, Medicaid, or client payments. The final option we have explored is diverting resources from programs that are underperforming or don't have the impact that we were originally hoping for. We completed a process called a mission matrix, which helped us look at a variety of factors to determine each program's impact on the clients, community, and on the bottom line of the agency. So whatever your solution is, there's likely more than one solution that will meet your needs. Instead, it will be a variety of different services and routes to take when looking at funding sustainability. Next slide. So with that introduction on sustainability, I also wanted to briefly talk about the services that we are offering through our current grant. So based on the needs we identified in the community and on our previous capacities, we knew that we needed a solid care management approach. Our 3 care managers meet with individuals living alone in the community that have been referred or self-identified as experiencing cognitive decline. After completing a brief screening assessment, the care managers then move forward with numerous assessments, including looking at home safety, activities of daily living, instrumental activities of daily living, nutrition, and living alone risk assessments. From those and through building trusting relationships, the care managers move to creating care plans. Those care plans can include occupational therapy interventions, help coordinating medical care, transitioning to long-term care, or any other person-centered interventions that might come up. Because home safety is such a need, we are contracting with an occupational therapist to perform an in-depth home safety assessment and making recommendations for various home modifications. And then she passes those on to our home modification coordinator, who takes over to do the installation of the modifications as needed. Through the grant, we are able to provide funding for most of the modifications that are needed. To further support those living alone, we also determined that there was a need for a new position, which we've called a client support specialist. He's instrumental in providing transportation, socialization, as well as assistance during medical appointments. This has been a vital addition that's added an extra level of support for the clients and for the care managers as well. Next slide, please. For those caring for someone experiencing memory loss, we found it vital to focus on support for caregiver burden, stress, and depression. We have 2 family caregiver support specialists that provide one-on-one support with the help of a program called T-Care. T-Care is an extensive assessment process that looks at all aspects of caregiving and based on the individual's experience, creates a care plan with the intention of reducing the particular stresses and burdens experienced by each caregiver. In addition to the support from the family caregiver support specialist, the caregiver can also access funding for home modifications and respite. Like many areas of the country, Montana has been hit hard by the lack of home care workers, and this has just been magnified for family caregivers. So to help alleviate that barrier, as I mentioned before, we created a volunteer respite program to help fill in the gaps. So far, we have 4 volunteers, and they have proved to be a major asset to the program. Next slide, please. So far, we feel our approach has been very successful and feedback we're receiving has been very encouraging. But now the real work begins, our approach to sustainability. In the next few slides, I'll just kind of build on what we've gone over previously and how we've actually put those ideas into play. Next slide, please. So our initial step was outlining a community approach to sustainability, looking first at demand, Our sustainability has its cornerstones in the results from two different surveys that were completed. First, MAS surveyed older adults in our service area, and 1/3 of the population self-reported experiencing some confusion or forgetfulness. For us, that means about 15,000 people are experiencing some level of cognitive impairment in our community. Second, we also surveyed the general community about which services they felt were most important. And caring for people with Alzheimer's and dementia was ranked number 2 out of that survey. Next, we wanted to look at our employees. So Missoula is home to the University of Montana and also an extension program of Walla Walla University, and both schools have robust social work programs. So there are plenty of trained people to do the work. However, like much of the rest of the community, Missoula has experienced sky-high inflation, making it very difficult for many people to be able to afford to live here. Because staffing has been an issue for our agency, we have been exploring more ways to engage volunteers. Fortunately, we do have an entire department focused on volunteering, and we have been able to incorporate volunteers into the delivery of our services. In addition to the respite program I mentioned, we also have volunteer caring companions, and we are currently developing a volunteer home modification program and a home chore program staffed by volunteers. Finally, it's important to highlight our partnerships when looking at a community plan. As the area agency on aging in Missoula and Ravalli counties, we have a robust network of service providers and referral partners. We have found that developing strong partnerships with the medical community has been especially important. Next slide. Our second approach is looking at our organization. So our work developing our home and community-based services program for people living with Alzheimer's and dementia has resulted in some changes to our care management program that had existed prior to the grant. So specifically, our processes now incorporate a more in-depth person-centered approach throughout the time working with a client. Many of our clients have little to no support, and the care plans created by our staff have helped to ensure clients are well supported in the community. A major change we made for family caregivers is implementing the T-Care program. It provides a systematic approach to address the stress, burden, and depression experienced by many people caring for somebody with cognitive decline. And we actually created a whole family caregiver support program within this with 2 dedicated staff because the support that the clients receive from that person is also just very invaluable. When they're having a tough day, they can just pick up the phone and give someone a call. Because these changes are now incorporated into how we do our work, we have built the capacity to sustain these services. Our capacity has also been improved by documenting our procedures, developing computer systems to support the work, and developing training processes for all of our employees. Finally, having complementary services was very important to our organizational sustainability. The most important complementary services we've been utilizing within our agency are Meals on Wheels, our homemaker and respite services, home modifications, money management, and information and assistance. Allowing our clients to access supports from various programs within our agency has helped to ensure continuity of care and wraparound supports for our clients. Next slide. Our final area of focus for sustainability was creating a solid financial plan. In June of 2022, we asked voters to approve an increase in property taxes to support aging services. And we are very blessed to have over 71% of voters approve the levy, which will provide over $600,000 annually to our agency. And I understand this isn't an option available across the country, but might be something worth looking into if that is available in your area. Additionally, as an area agency on aging, we receive funding from the Older Americans Act, and part of that funding is earmarked to caregiver support services. It is our intent to redirect some of those funds to sustaining our family caregiver support program in the future. We also intend to apply for grant funding to expand our home modification program to more people. Those grant funds are available through various federal agencies and private foundations. Looking at fee-for-service options, we have already begun to operate a fee-for-service home modification program for non-grant clients. While the program is still quite new, it is proving to be successful. Through our experience with the home modifications during our grant period, we were well positioned to expand services. Additionally, it is important for our first fee-for-service program to be a tangible service like home modifications. People are accustomed to paying for such services, and we are able to provide the support at a discounted rate. Eventually, our goal is to create a fee-for-service care management program that includes care management, home modifications, home chores, in-home support, and transportation. We found that people just really don't really see the value in just care management on its own. So our goal is to pair it with other services as a more wraparound approach. And finally, as mentioned earlier, volunteer services is an important aspect of our operations. And we anticipate applying for a community core grant through ACL. And then this potential funding will help support volunteer programs across our agency. Next slide, please. Well, now to the final part of my presentation, the lessons learned. Let's just say we have learned a lot throughout this process. First, I just want everyone to know how important it is to consider your frontline staff. The program we created was much more intensive than we first realized. The clients we have been working with have much higher needs and historically fallen through the cracks in our community. We found it necessary to provide a triage assessment tool for our staff to ensure they have the capacity to take on more clients. Additionally, because the client situations are so challenging, we have focused on supporting our staff. This includes regular check-ins, building a cohesive team environment, and acknowledging when staff are at capacity and need extra support from coworkers or supervisors. Next, data collection has proven to be a steep learning curve. While we have a comprehensive client database, it has not been able to collect all the assessments in a meaningful way. So we created supplemental spreadsheets with pivot tables in order to track our assessments and show change over time. This has helped to see if our interventions are having a positive impact on our clients. With all the assessments we've implemented, it's also important to have clear procedures for staff and supervisors to ensure reassessments were completed and that client follow-up was happening in a timely manner. Finally, while we have not had issues receiving referrals, we have learned a lot about client engagement. Our grant clients have required a much slower approach. Many clients are dealing with the stigma of having cognitive decline, and they're also very concerned that someone is going to remove them from their homes and maybe force them into a nursing home situation. Or additionally, due to the cognitive decline, they do not realize that they actually need more support to successfully remain in their homes. And so just really taking time to build the trust and the rapport has helped enable us to provide more support. And when working with family caregivers, we're also faced with the caregiver's lack of time as well as extensive burden. And many feel that accessing the support will just be another thing they will have to manage. And so over the past few years, we've just learned to address our approach and offer flexibility and creativity whenever possible. Next slide, please. So we all know sustainability is a factor that's ever present. To summarize, I just wanted to highlight one thing. Sustainability has many factors. We have decided to focus on the financial, community, and organizational approach. So be sure you're not only thinking about how to fund your programs, but also, do you have the staff capacity? And is it something that the community will access, or major questions that you want to look at? While we generally tend to put most of our focus on the funding, without the latter two, program success may be limited. So, well, I know each person on the call today represents a different agency with different approaches. I believe our goals are very similar. We all want to develop services that meet the needs of our clients in a meaningful way. So I hope you got a few new ideas today, and thanks for your time. Next slide.
Great. Thank you so much, Shelli. That was some great information. There's many things in my slides, I think, that echo what you had to say, and hopefully I'll be able to complement more of what you did. Next slide, please. So I too would like to thank our ADPI grant. It's number 90 ADPI 0008-01-00, which is from the U.S. Administration of Community Living, Department of Health and Human Services. Our grant actually ended in September of 2022, and we are continuing to carry on the activities that we started through our ADPI grant. So our goal was to work on building dementia capability through our community through collaborative partnerships with organizations. We hope to increase awareness both at the community level and the professional level about the needs of individuals with dementia who were living in our community. And ultimately, the hope was that we would, through our work, start to improve the quality of life for people living with dementia. Next slide, please. So our grant actually, we worked on our projects through community partnerships. The organization I work for, Memory Lane Care Services, is a traditional aging services provider, and we were the grant lead for our organization, but recognized pretty quickly that we needed to pull in some other organizations who were truly experts in areas which we were not. We provide primarily respite care and caregiver support for aging individuals, but did not have a lot of experience serving people with intellectual and developmental disabilities. So our local county board of DD was a very strong and active partner in our grant. They were really looked upon as the experts in the IDD community. And as we continued with our work, we leaned pretty heavily on them for their expertise and support as we moved forward with our activities. We also worked with the Ohio Council for Cognitive Health. That organization is the state lead for our Dementia Friends program, and really took the lead in providing training and adaptations for the dementia program to meet target populations of our grant, and served as trainers. And I would encourage grantees, if you do have a Dementia Friends lead in your state, to reach out to them if you haven't already, to look at ways to collaborate with them. Our Area Agency on Aging was another active partner in our grant. So that logo in the middle of our slide that says AOA is actually our Area Agency on Aging. They're called the Area Office on Aging of Northwest Ohio. They were a strong referral source for our grant and were very active in our education and training programs that we were offering. We collaborated also with the Benjamin Rose Institute on Aging. We were delivering the evidence-based program BRI Care Consultation. So they really were the experts for us, so that we had, we were making sure that we were maintaining fidelity with the program, as well as we made adaptations. They were able to assist us with that and give us ideas for marketing and promotion and such. Miami University Scripps Gerontology Center was our evaluators for the program, and were very helpful as we were looking at data collection methods and capturing evaluations. We were able to utilize their expertise in their area to to make sure that we were gathering information and evaluating it in a consistent manner. Aetna Better Health was another partner with our grant. And what they actually primarily focused on was training, but it was kind of interesting. Our grant started in 2018, and we started our training activities in 2019 before the pandemic started. And Aetna came to us because we had anticipated doing most of our training face-to-face. And they came to us and said, we're used to doing most of our training via webinars, and we wanted to train all their care managers. And so we worked with them early on to develop training programs through webinars and really leaned on their expertise because most of us had not done much with virtual training at the time. And so when the pandemic hit, it really allowed us to transition really quickly to virtual programming. And then Manahan is another IDD program in our community that serves individuals with IDD. And they provided training and expertise, again, with that community, not only with individuals who care for people in various settings, but working with family members. And what was interesting with Manahan is they had a number of individuals in their workshops and that lived together where an individual was experiencing dementia. And so we worked with Ohio Council for Cognitive Health and developed a Dementia Friends program specifically for people who had intellectual and developmental disabilities so they could gain a better understanding of what was happening to their roommates and their friends at workshop. So really, as a group, our grant partners worked together to carry out the grant activities. And all of these members also served as part of a community coalition that we started with this grant to guide our work, to provide expert input, and to increase engagement in the community in the activities that we were wanting to move forward with. Next slide, please. So one of the things that was really, really helpful that we used during our grant, as well as we looked to sustain our grant activities once our grant was nearing end, was our Area Agency on Aging conducts needs assessments and provides a lot of data around community needs and in the populations in our areas. So we were able to utilize their data to look at numbers of people who were living with dementia in our community or experiencing cognitive impairment, so that could help support the need for our work, as well as make sure that we were staying informed in regards to the needs in our community. Next slide, please. And another interesting data point that our area agency was able to provide was this heat map. This is a county in which Toledo sits in. And this heat map provided by zip code information of individuals that live alone that are 65 and older. So as we were looking to do outreach efforts in the community with our programs and things like that, it really helped us to narrow in on some areas. And we continue to use this information as we move forward with our work. Next slide, please. So with our grant, there was 3 targeted activities that we really worked on that we are continuing to sustain today. One of them I mentioned was we developed a community-wide coalition. Initially, this helped to advise and inform our grant work, but over time, this community coalition has expanded. We have more individuals besides our grant partners engaged in our work, which allow us to work together to make our community dementia capable, more into community friendly for individuals and their caregivers. So we're pretty excited about this coalition that we've been able to continue carrying on its work. We also provide a number of dementia-focused education programs through our grant. We delivered the ACL Brain Health Program, Dementia Friends that had adaptations for individuals living alone and for individuals with IDD and dementia. We also provided some in-depth IDD training using a national expert, Dr. Philip McCallion, and we actually ended up collaborating with another ADPI grant in our grant during the pandemic, and because this program was being delivered virtually, and so we were able to collaborate and work together to deliver these trainings to a larger geographic population in our state. And then we also adapted a program from the state of Minnesota's Act on Alzheimer's that looked at behavioral symptom management for family caregivers. One of the things that was really nice with our grant is we used pre-existing curriculum. So we didn't need to reinvent the wheel, and we were able to move pretty quickly from being trained in these programs and content and delivery mechanisms to reaching them out to the community very quickly. And then we also delivered the evidence-based program, BRI Care Consultation, through a couple different agencies in our grant. Next slide, please. One of the things that we utilized during our grant period, because we knew we were working with a community coalition, was utilizing the collective impact model. There's a lot of really great information out about the collective impact model. So if you're not familiar with it, it might be something to consider as you're looking to engage other organizations. But we found that, really staying true to the elements of the collective impact model in our work with our grant has really helped to sustain our activities post grant period as well. So we really kind of looked at the elements of the collective impact model, became very familiar with it, and used it kind of as our guide, as our North Star, as we were moving forward and implementing our work and sustaining it post grant activity. So if you look at the elements of the collective impact model, the common agenda, where we had a shared vision amongst our community members, shared measurement, where we defined and looked at data together and held each other accountable for collecting it and measuring it. And then the mutual reinforcing activities, one of the things I think that was really helpful with our grant is the work that we were doing really aligned with the other organizations' worked. So it was easy in some ways to build it into the work. The work was hard and took a lot of time to do, but it really aligned with our missions and helped us move forward. Another component of collective impact is continuous communication. So having open communication, sharing the stage with people, and building trust over time really helped us with moving forward with our grant. And then having a backbone agency that really served in a role as a convener and a coordinator, not always the expert, not always the leader, but just keeping to move things along. Next slide, please. So our grant ended, as I mentioned, in September of 2022, and we've been able to sustain our dementia-focused education programs. We've been able to sustain our BRI Care Consultation through one of our agencies, and our Dementia Coalition continues as well. Our education programs are actually being delivered by a multitude of agencies. It's not just one organization. So one of the things we worked on really, really hard during the grant was using a train-the-trainer model and building a lot of champions in our community that can continue to deliver the programs. And so things like the brain health program are still being delivered in senior centers and in libraries, and the IDD and Dementia Basics program is still being delivered by our county board to service providers and family members. And many of the organizations that have been involved in our coalition have taken these programs because they've been trained in them, and it's a train-the-trainer model, and they've even adapted them into like their staff orientations and their volunteer training, so they have some consistent training that's being offered throughout the community. Next slide, please. Some other strategies we use to sustain our activities. I know Shelli talked about this too, but the importance of data. We use data not only during our grant period, but to collect information, but it really helped us to build a case to support sustainability. Using the numbers, using the outputs and the impacts and the individual stories from people really helped to create a story to show impact. And then we were able to share that with people within our organizations, with people out in the community, which really helped to build buy-in and maintain buy-in as we moved forward with continuing to deliver these programs. We also used the data as we were nearing the end of our grant and we started applying for additional funding. The data that we had collected during the grant and we still continue to collect project was really, really helpful when we wrote our RFPs. And we used the data also during the grant period. We shared it regularly. We shared it annually with our boards of directors, with leaderships within our organizations at the various partner agencies. We shared it with the staff. So that they had a good understanding and could share it when they were out talking to community members. And we also shared it with leaders in key organizations within our community. So even if they weren't directly involved with the grant, they knew about the work that we were doing and how we were trying to make a positive impact in our community. And so one of the things we asked our evaluators to do during our grant was create an infographic that they updated annually. We actually took time each year and have our evaluators kind of really go over it and explain it with all of our grant partners. And then this infographic was really, really helpful for a number of agencies because they shared it with their leadership and other partner organizations to explain the work that they were doing. So if you can go to the next slide. This just shows a picture of the infographic. It was pretty simple. You know, our plan is that at the end of this year, we'll plug in new information, but we used the same format every year. So people got used to it. But again, it showed outputs, it showed impacts, as well as, you know, great information about the work that we were doing. Next slide. And that's just the second page. So again, it's just kind of gives you an example of some of the things that we were doing to really try and explain and share and incorporate the data. Next slide, please. Shelli had mentioned that looking at funding. So we did start exploring and looking for funding. And one of the things we were able to do with our grant was secure some funding for our evidence-based program, the BRI Care Consultation. We found that it aligned with local, regional, and state needs that had been identified through assessments like through our area agencies on aging and our state plans. We were able to tap into Older Americans Act, Title III-D and Title III-E funds to support the evidence-based program. And we've actually just recently applied, but have not heard yet about to a local county senior services tax levy. I know not every community has those, but for communities that do, sometimes programs like this can be funded through such. Next slide, please. So one of the things I just kind of wanted to share, because it was just so very clear to us as we were looking at applying for funding for as our grant ended, an RFP came out from our area agency on aging, and they were looking, and these bullet points actually came directly from our application. They were looking at funding services that were evidence-based programs that looked at alleviating negative effects of social isolation on older adults and caregivers, that were for individuals, programs that were for individuals living in rural areas and at risk for institutional placement, as well as programs that met target populations of older adults with dementia and Alzheimer's disease and their caregivers. So as we worked to put our RFP together, you know, we were able to use our evidence-based program, BRI Care Consultation, and really develop a strong case in our RFP for funding. So next slide, please. Some other strategies we looked at as we look to sustain our activities is a lot of times when you hear about sustainability, you hear about program fit. And the programs that the activities that we were doing through our grant really fit well within our agencies. So the evidence-based program and the education programs not only fit within the organization that I work for, but many of our grant partners, as well as other organizations who had joined our coalition. They aligned with our local area agency on aging and state focuses. I'm sorry. And also met individual needs of our area agency on aging and state plan. Another aspect of sustainability is really looking at champions that can help support your programming. And that needs to be not only one person at one organization, but champions at multiple organizations that can really have buy-in and really help promote the efforts of the work that you're doing. And there's a really strong belief in them. We've been really fortunate that we have really great champions through our area agencies on aging and our local boards of DD and our dementia friends too. State leads have been really, really helpful in ensuring that we're continuing to deliver services on an ongoing program. And then another strategy we've used is continuing to engage people in the work that we're doing. So not only is it the people who have been involved from the get-go, but we're always looking to new individuals to get involved in our work and support the work that we're doing and be engaged in our work. Next slide, please. I mentioned earlier, another way that we've sustained our programs is we've used a train the trainer model for education programs. So we have multiple individuals at multiple organizations trained in the dementia specific programs that we delivered through our grant. So these organizations are continuing to offer these programs in their community, within their organizations, as well as to family caregivers and target populations. We've recorded some of our programs and placed them on YouTube. Our Dementia Friends State Lead continues to provide champions programs and refresher programs. So for individuals who have already been trained, they can still get refreshers, which is really important to do. And we're in the process of developing some self-paced virtual options as well. Next slide, please. This is just another example. Our local area agency on aging really took the lead with helping to sustain our dementia focused education programs by creating a page on their website that's a speakers bureau for the dementia education programs. And they have a staff member who kind of serves as the clearinghouse. So when individuals contact them, they can reach out to all the coalition members and see who might be available to offer that training and move forward from there. And then they also market the program for us as we continue to deliver this program. Next slide. And then certainly from a resource investment, in addition to funding, you need people to continue to move forward with these things. So Memory Lane has served as the backbone agency for our community agencies. We have partners who continue to serve in leadership roles with their dementia specific activities. And our Dementia Coalition continues to move forward in providing activities. And we actually reached out. I think that many communities, have what's called our leadership. We have what's called Leadership Toledo. I think, leadership, I'll see in other communities, they have leadership organizations where people are looking to volunteer and do work in their community. So we actually applied for one of our Leadership Toledo projects, and we have a group of business people who have really been excited because they've had personal experiences with dementia and are going to be taking and organizing an event to reach out to businesses in our communities about how they can become dementia friendly. Next slide, please. Some of our challenges that we've experienced, not all of our adopters that were in our grant have been able to continue providing evidence-based programs once the grants ended. Our buy-in and investment of research from community partners has changed over time, and this has been a lot of times due to staff attrition and turnover. And our grant was in the middle of the COVID pandemic, so that certainly had an impact on our work. I think, it's still important that we recognize we're still living with COVID, and even though we wished it was all gone away, it's still impacting us on a day-to-day basis. And then another challenge is one of the things we want to make sure is our education programs stay up to date in science and information. Next slide, please. Lessons learned. I think what I could stress more than anything is building relationships with community partners. You never know what door's going to open based on the relationships that you build with people. And you need to start those early, and you need to maintain them, and you need to continue to work on them. That they take work. It's not just something you can do once and expect to come back 2 years later and work on something. So building relationships and engaging people is important. The collective impact model has been a really successful way for us to maintain our program. So that might be a model for others to look at too. Utilizing leadership and learning to share the stage with people. You know, there were times, many times throughout this whole entire grant where we did not, it wasn't necessarily me or our project coordinator leading the grant, but it was someone from the board or someone from our area agency. So working together and collaborating really helps to build trust and buy-in, and helps to move your program forward. And engaging others. You know, we're a big believer in many hands lighten the load, and the more heads at the table, the better, to be able to think things through. Utilize your data, constantly communicate outcomes and impact. It's not one time, but it's constant. Be adaptable, adjust and flexible, and shared project ownership, although it can be harder in the long run, certainly ends up for a better product. So next slide. And there's my contact information. Thanks for your time. I hope this was helpful. And thanks to our grant partners. You know, it really has been a collective group effort. And if it, you know, I'm honored to be there today to present this information to you. Thank you.
Thank you so much, Salli and Shelli. We will move to questions. Feel free to continue entering questions into the question and answer pod while we get started. The first question that came in was for you, Shelli, and the person was asking, what tasks do volunteers do who work with you, and how do you cover their activities? Is there a budgetary impact to your home care services?
Gotta unmute. Yes, so all of our volunteers in our volunteer department are covered under a supplementary insurance. It's called CIMA, C-I-M-A. And if you reach out to me, I could get you in contact with our department head in that area. But so that covers above and beyond what any of it'll cover, you know, any accidents or things like that that might happen. But our volunteers are, so they're providing the respite. So they're staying with the care receiver while the caregiver goes out into the community. We also have our caring companions, which are matched with an individual at risk of isolation in the community. And they have weekly set times where they can go out grocery shopping or out to lunch or just staying at home playing cards, just really that socialization piece. And then just a whole host of other things. We have about 300 different activities that volunteers can do. And we also partner with a lot of community agencies that need volunteers, and we can help send volunteers to their groups or businesses.
Great, thank you. Salli, you could start with the next one. If you have any tips to continue having an engaged community coalition after the grant ends.
And yeah, that's a great question. So one of the things that we did is we started talking about sustainability about 18 months before the grant was over. So we started talking with our community coalition about, you know, this is what our plan is for the next 12, 18 months, 24, you know, are you still interested in being involved? And, you know, what we found is people definitely were. The other thing is we really try and make the workload manageable. So our coalition only meets 4 times a year, and we do activities in between. But we have used, continue to do small incremental steps. So, you know, we're not trying to light the world on fire, but continuing to develop, we work together and poll our coalition and ask them, what are the needs that you're seeing? What do you think we should work on next? And we really listen to what they have to say, and have developed that shared agenda through that collective impact model to continue to engage people and continue to move our work forward.
Great. Thank you so much. Shelli, do you have anything to add about that?
I think those are all really great points. The one thing that we've learned as well is just really a lot of people aren't aware of what the needs are. And so really being advocates for the individuals that you're working with and letting people know the struggles that folks that are aging are facing, because a lot of people don't know until they're in the thick of it. And so that's one piece of advice there. So.
Great, thank you. Can you talk about any barriers that exist and overcoming barriers when working with healthcare entities for these programs? Salli, I think that was directed towards you.
Sure. We had a lot of barriers and we had to continue to adjust during our grant implementation, primarily because of COVID. I know one way that we were able to engage some of the healthcare communities is we did offer CEs for our education programs. And so that was a way to kind of bring people in and, share our message. And we would talk about our work of the coalition and the delivery of the evidence-based program as part of the, kind of at the tail end, typically, of the education program that we were offering. So I think ways to look at how our work could be of support to healthcare communities, we found through education was really, really helpful. And then because of some of the outcomes that we've seen through the evidence-based program, and I know, all the evidence-based programs have, proven outcomes. And so looking at those proven outcomes and tying them into the work of the healthcare system and having discussions with those providers really helped. You could kind of just see the light bulbs start going on. I know we talked with some of our geriatric physician offices, and once we started telling them what they have now, they email us if they don't hear from us and say, hey, what's going on, what's new. We've shared tip sheets with them through the grant that we continue to offer to them, and so if you can make a connection to their work, I think that really helps, particularly if they know it's going to be of support to their patients that they're serving. And if you can ever get a caregiver or a patient, I think, to talk to a healthcare provider, because the proof is kind of in the pudding, that usually will go a long mile with additional referrals and bringing on people on board to your work. So I don't know, Shelli, if you'd have anything to add to that.
The one thing that we found was making it easy for referrals to come into our office because all healthcare providers are super busy. And so we just added a HIPAA compliant link to our website to where they could just type it in and it would come directly to the department leads for those. So that's been a great success for us.
Yeah. And sometimes the less information they have to provide, the better.
Exactly. Yeah.
Great, thank you. Shelli, can you just briefly touch on if your care management fee for service is going to be on a sliding scale based on income? Are you thinking of a flat rate? How are you structuring that?
So it will be on a sliding fee scale. And so what we use is the elder index as opposed to just like the poverty rate. So the elder index looks at income, self-reported health status, and also if they rent or own their home. So if they have any housing costs, to kind of look at the whole picture. And so we base our sliding fee scales on that for the entire agency for Meals on Wheels, and which is also just a volunteer donation. But also for our in-home care is also on a sliding fee scale because many people cannot afford the going rate for those types of supports. So.
Right. All right, great, thank you. Well, we have run out of time. So thank you to both of our presenters for these excellent presentations and for being with us today. And thank you to our participants for tuning in. I want to remind you that our next webinar, Veterans Health Administration's Strategy to Promote Aging in Place for Veterans, will be on May 25th from 3 to 4 p.m. Eastern Time. If you haven't already, you should receive registration information via email You can contact NADRC-webinars@rti.org if you need more information, and we hope to see you there. Have a great afternoon, everyone.
Thank you.
Thank you.